Hi, everyone. Welcome to Alternavita. Thank you for stopping by and thank you for your time. I'm very late today and I'm just going to be going over my notes here and reading from some pre-prepared PDF because as I did not write the post yet for this week's video, but it's about SIBO, and there are some new developments, so I did not want to forget those when it comes to SIBO, but you will see as I go over these here, going back to the beginning here of this chapter, so that I can start properly. But as you'll see, I have been way ahead of the curve when it comes to SIBO because I followed one of the foremost world experts on SIBO, and that would be Cedars-Sinai and Dr. Mark Pimentel, and his esteemed colleague, Dr. Henry Lin, the H2S expert, who has written many good papers about H2S in particular, and I learned a lot from both of them. So this chapter, I'm covering, I forget what number it is. I don't have them numbered. I think it's number 8 maybe, but it's SIBO. Why SIBO matters and why a proper diagnosis for SIBO matters. A proper diagnosis for SIBO matters because SIBO is a condition in which there is an increase in bacteria in the small intestine. It's also associated with motility problems, and prognosis is very poor, dependent upon the underlying conditions that led to SIBO. SIBO is highly associated with IBS. I think it's up to 40% of controls in IBS have SIBO, and that was generally not found in the control population. So it's highly associated with IBS. IBS was once thought to be psychogenic, and SIBO is often misdiagnosed and generally undiagnosed. General symptoms include dyspepsia, bloating, and abdominal discomfort. And I can tell you that in my case, those were all severe. SIBO affects both infants and the elderly disproportionately, and the medicines used to treat IBS and numerous other gut conditions might actually lead to SIBO, making diagnostic tools a crucial investment. H2S SIBO may be the most dangerous form of SIBO. So I'm going to go over again quickly H2S, known as sewer gas. H2S affects the gut, the liver, the immune system, the nerves, the heart, and the brain simultaneously, and H2S is highly poisonous. Small intestine is much less efficient at detoxifying H2S. Normally it's detoxified by oxidation, and it's normally rapidly metabolized by a specialized detoxification system in the gastrointestinal tract. But the small intestine is much less efficient in detoxifying gas. H2S then enters the portal vein, where it's oxidized by oxygen, and then After that, the majority then enters the liver once the system is overwhelmed. So H2S is pro-inflammatory. It affects the gastrointestinal smooth muscle cells, and it contributes to chloride secretion, which aggravates certain types of gastritis. An increase in steady H2S levels is thought to play a role in inflammatory bowel disease and related cancers. H2S has been termed rocket fuel for cancer in some leading university studies. H2S is also a byproduct of dietary sulfate metabolism by gut bacteria. Inflammatory bowel disease, such as colitis, are associated with an increase in the colonization by sulfate-reducing bacteria, along with an increase in H2S production. So H2S is also a gasotransmitter, producing oxidative stress. H2S has long been regarded as a strong toxin that inhibits mitochondrial respiration. And in my book, I tell you how that happens. H2S is continuously produced by sulfate-reducing commensal bacteria in the colon, and excess H2S could contribute to unwanted T cell activation. And what else? All of these findings establish H2S as an endogenous and exogenous co-regulatory signal for T cells. H2S can paralyze the nerves and has an inhibitory effect on the ileum. H2S can cause immediate paralysis of the olfactory nerves. It can lead to demyelination of nerve fibers in the central nervous system, and it can cause respiratory tract injury. It can also lead to endotoxin-induced cardiovascular collapse and apoptosis of human aorta smooth muscle cells. SIBO can cause mild chronic encephalopathy. SIBO is also related to immune deficiency syndromes, most commonly IgA deficiency. Okay. IgA is a protective role, plays a protective role in breast milk, and an increased prevalence of infections after weaning is not completely related to the deprivation of IgA, but it's also linked to the introduction of new foods and exposure to the outside world, in part by the absence of additional protective factors in breast milk. So as you'll see, I'm going to get to this shortly regarding the two bacteria now implicated in SIBO. But before SIBO was termed SIBO, serum levels of folate and vitamin B12 may be used to support evidence of bacterial overgrowth in pediatric settings. This was the previous test that they used for testing for bacterial overgrowth. The rationale for this test is that adequate folate levels and synthesis of folate by intestinal microflora also contributes to the host folate level. Therefore, serum folate levels may increase while vitamin B12 levels decrease as a result of SIBO. However, measuring B12 and folate levels were found to have a poor diagnostic yield. Okay. Due to the difficulty in diagnosing SIBO, they are looking into DNA testing. Infants who are not breastfed are in an early stage of sulfate-reducing bacteria, and methane-forming bacteria settled. And another relation to this is poor sanitation. And this paper in which I found this about infants was from 1993 and 1998. And it was in regards to bifido and soil erosion, namely manure. As you'll learn, both of the bacteria implicated in SIBO are contaminants. Even though they are found naturally, they are highly associated with poor sanitation. Another interesting side note in relation to B12 and folate levels. B12 is an antidote. High doses of vitamin B12 are an antidote to H2S poisoning. So that might be a little factoid that you might find interesting. So SIBO cause conditions include, and this is from a Cedars-Sinai paper, one of the major reasons I appreciate the level of integrity from Cedars-Sinai and Dr. Mark Pimental. These conditions include IBS, fibromyalgia, as you'll see here shortly. SIBO is also highly associated with fibromyalgia, chronic pelvic pain syndrome, chronic fatigue syndrome, depression, impaired mentation, impaired memory, halitosis, tinnitus, sugar craving, autism, ADHD, drug sensitivity, and autoimmune disease such as MS, SLE, lupus, and Crohn's. So in 2018, I believe SIBO, the new test for H2S SIBO specifically was introduced. A new 4-gas breath test device. I can't remember the name of it off the top of my head, but that also specifically looked for H2S, helped diagnose H2S SIBO. And another little factoid you might be interested to learn about aberrant H2S production and fructose is related to the vitamin pantothenic acid, which is a B vitamin. So SIBO patients also often have severe vitamin deficiencies and malabsorption. And of course, those include the B complex vitamins. So there are several intrinsic and extrinsic factors that prevent overgrowth of bacteria. And one of these, I'm just going to go over a couple of them. Secretion of gastric juice and bile, which have an antibacterial effect. Peristaltic movement, preventing adherence of bacteria to the intestinal mucosa. When it comes to E. coli and associated E. coli infections, this would include translocation. Diet and drugs modulating extrinsic factors includes diet and drugs modulating the gut flora, and gastric acid suppressants and proton pump inhibitors, PPIs, H2 blockers, antibiotics, and drugs altering motility. Specifically, opioids would be one. Okay, when it is not SIBO diagnosis, This is important because this is associated with carbohydrate indigestion. Geez, let me just move this a minute because my screen is carbohydrate malabsorption. Dysbiosis may contribute to the development of symptoms in a subset of IBS patients, though SIBO is a form of alteration of small bowel microbes. Altered microbiota does not necessarily mean SIBO only. These gases may also be produced in the colon among patients without SIBO in the presence of carbohydrate malabsorption. So if you have a hard time digesting carbohydrates, which is associated with many problems, including anxiety disorders, and associated with malnutrition, that might be something you want to consider to be sure to rule out and not just jump the gun and blame SIBO. A healthy microbiome is necessary to prevent SIBO. So E. coli is commonly isolated in patients with bacterial overgrowth. Certain species of bacteria are more commonly found in the aspirates of the jejunum taken from patients with bacterial overgrowth. So I'm not going to go over these little factoids, but I'm going to go into the bacteria now known to be causative of SIBO, and that is E. coli and Klebsiella. You might be more familiar with Klebsiella as causing pneumonia, specifically in AIDS patients, drug addicts, alcoholics, general malnutrition syndromes. And you might also find a little association of Dr. Mark Pimentel being one of the developers in the UV lung machine that will help treat pneumonia. I don't know where that is in the pipeline of being approved or not, but I'm sure that his research in SIBO is commonly associated with pneumonia as well. So, and other pulmonary and lung problems. So you might find that association interesting from one of the leading experts in SIBO. SIBO can sometimes be triggered by an acute gastrointestinal infection. Now, I wrote this before these two bacteria were confirmed, but they were definitely in my list. And Klebsiella is a very common contaminant found in foods, baby formula, soil runoff, contaminant in tomatoes, lettuce, potatoes, probably spinach, many produce items. It's also been found in infant formula. It's also associated with some manufacturing, like pulp, paper mills, wood processing. I forget what else, but it's a very common contaminant, along with E. coli as a contaminant. Both are associated with poor sanitation. Klebsiella breakouts often occur in hospitals, and in that case, Klebsiella is a normal inhabitant of the gut bacteria of humans and animals. So they don't quite understand how it becomes a contaminant, but nevertheless, it is associated with poor sanitation. So that is the other one. Normally, I associated it with E. coli because that was number one on the list. But there are other isolates associated, and some of them were Streptococcus, Bacteroides, and Enterococcus species. So I think that's pretty much all that I wanted to say was about SIBO and why a proper diagnosis is important. Namely, that H2S is one of the most dangerous forms of SIBO. SIBO has a very poor prognosis due to malabsorption and malnutrition, and it is not something that you want to let go. You can end up very sick, very malnourished, and highly inflamed. And when it comes to H2S, as I said, a leading university studies have termed H2S as being rocket fuel for cancer. Again, SIBO can't begin at birth, and it is not corrected by diet. And the patent where I mentioned that was a patent for Bifido. Cedars-Sinai has also patented Bifido strains for the treatment of SIBO. They might have withdrawn those since that time, I don't know. But as you know, Bifido alteration is associated with SAM, and the top risk factors for SAM are not breastfeeding, food security, and poor sanitation. So those are the top risk factors for SAM, and that in turn leads to association with 95% of chronic conditions, and you saw that relatively intensive and umbrella for thousands of conditions associated with symptoms and syndromes associated in that small list I gave you from Cedars-Sinai. And don't forget, IBS is highly associated, autoimmune is highly associated, and they actually use the word caused, and that's a pretty bold, they definitely know what the word caused means. So that was a pretty bold statement by Cedars-Sinai, and that was way back in 2014. Okay, so those are just some of the further validation that you'll find in Immune for Life, published in 2019, and I began this Alternavita in 2015. So this has been almost 10 years for me, and all of these connections are just being further validated, and you'll find them all in Immune for Life. And don't forget, the ebook is now available, so I hope you will certainly check that out at least. However, it's always a good thing to have a hard copy, because the majority of the information in the book will never be obsolete. It's just being further and further validated with each passing year. So, okay, everyone, thanks for your time. I'll see you next time. Bye.